communication with our staff has been ongoing over many years and has been always directed towards quality. Beginning with patient-centered medical home, moving into the electronic health record, then on to meaningful use. I think our staff understands that this was more of a quality initiative than it was a logistic initiative.
I think one of the key elements to success is that from the upper parts of leadership, there has to be a mandate that this has to be achieved.
We went to our HIE friends at CRISP. We had a conversation with them, identified our HISP, got our HIE friends on board, and started having some initial dialogues, some weekly meetings for, let's say, a month or so, and trying to just educate ourselves and understand what was it that we needed to do.
You have to be very careful in a healthcare setting when you're changing a process that you want to make safety job one. So oftentimes we would even get risk management involved in helping us map out these processes so that we knew we were not going to have any gaps in care that would occur as we made these changes.
The whole idea behind healthcare is that we are able to exchange clinical information effectively across different systems, hospitals, providers, specialties, and so on and so forth. And as our patients transition to those places, being able to give information in an efficient way is very, very important. The transition of care process allows us to do that. And it allows us to do it electronically, so we can send summary of care information to the provider or the specialist that needs that information. And they can respond back and let us know when they've closed that, when they made that appointment and they've closed that referral process.
An information services department, whether they are part of a medical group or a hospital, has to understand that they are now providers of care.
We had to work with those providers who were going to receive our patients, so we had to go out, help them understand direct addressing, and in many cases even set them up with direct addresses, help them talk to some of their system providers about being meaningful use stage 2 ready so that they could ingest the information, and then start the whole process of piloting or testing the sending and receiving of that data.
Obviously, we wanted to make sure that everybody was trained appropriately. The training of that many people all at the same time without interrupting good patient care was a challenge. Our electronic health record vendor was very, very helpful in the process. They gave us personnel to help with that process. I have a very good staff that I work with, and they were instrumental in building a good training program.
We recognize that everyone from the registrar, to the ER nurse who then picks up that care, to the physician who then is treating inpatient, to the lab tech who's filing that lab test, that all of those processes and all those communication systems have to tightly be integrated. And the technology can be one level of that, but the process has to be there on top of it.
We need to evaluate everything in regards to these meaningful use measures and the transition of care, because we cannot change the output. So we've put together a complex change control process, so anything that gets changed is reviewed against all of the meaningful use measures to make sure there's no negative impact.
The electronic referral process was a very important part of our overall implementation of the electronic health record, because it allowed us to communicate very, very effectively with the specialty groups that we team with to take better care of our patients. The P2P portal, or the physician-to-physician portal, was very, very beneficial to us. And it was also beneficial, obviously, to the specialty groups because they could communicate directly with us, and that communication would go directly into our electronic health record, which would then go to our physician. So the whole referral process was made far more efficient.
Because of the work that we've done here with transition of care, it's really laying the foundation for the next step.
I hope when we get to that point that it literally will be that easy for people to have access to quality care anywhere they are, and that the information that is needed to take care of them is available.
We are creating value for our patients. We're required to see fewer patients in a day. They're fed information in a timely fashion. Patients recognize the value. We are creating an environment for doctors to take better care of patients.